Hello and welcome to the National Press Foundation. We're coming to you from the Evelyn Y. Davis Zoom studio. I'm Chris Adams, Director of Training for NPF. Today we're excited to be continuing our series on poverty and inequality in the United States. We're talking about poverty in children in the age of COVID. Our guests are Anna Johnson, Associate Professor in the Department of Psychology and Co-Director of the Child Development and Social Policy Lab at Georgetown University, and Hiro Yoshikawa, a professor of globalization and education at the Steinhardt School of Culture, Education, and Human Development at New York University. Welcome to you both. We're going to go first to Anna Johnson of Georgetown, who is going to talk about, give a big picture overview of children in poverty and talk about research that she had in the field already when COVID hit. And she's going to talk about the impact that COVID was having on food insecurity and education issues in two of her experiments, as well as talking about the big picture. She'll talk for 18 or 20 minutes, presenting with the slideshow. If you have a question, we can throw some questions at her during the slideshow, and then we will turn it over to Hiro Yoshikawa. So Anna, welcome and happy to hear from you.
Thank you. Thank you so much for having me. I was just saying before that, I'm all about making things better for vulnerable children in this country. And the first step is informing people of what's wrong. You can't fix what's wrong until you know about it. So I'm so grateful for the foundation and the foundation's funders for this platform, and also to all the folks who've listened in. So together, I think, spreading the word about what I'm going to refer to as a public health crisis, poverty, on top of a pandemic, is the only way to fix it. So I'm Anna Johnson. As Chris said, I'm an associate professor of psychology at Georgetown University, and I co-direct the Child Development and Social Policy Lab here at Georgetown. So I'm going to start by saying boldly but confidently that poverty is a public health crisis in the United States. And I'll tell you in a moment why, but spoiler alert, it's incredibly widespread, and it's known to have very detrimental impacts on a host of lifelong outcomes. So in 2019, nearly 13 million children, or 17% of the child population in the United States, lived in poverty. And to give you a sense of what the federal poverty line is, it's about $19,985 for a family of three. And if you imagine spending $1,000 a month on rent for a place that could accommodate three humans, and where I live in Washington, D.C., that would be hard to find, plus $500 a month on food, you've pretty much maxed out that budget right there. That doesn't include transportation, childcare, medical needs, household basics, education supplements, et cetera. So the poverty line is a very low bar on basic needs, and I would argue doesn't even account for what basic needs cost. So nearly 13 million children are living on an unlivable household income. We know that the poverty rate is higher for our youngest children. So children ages 0 to 6, poverty rates are closer to at about 21, 22%. And rates are higher if you expand the definition of poverty to be low income, which is the terminology I'm going to use today. And that is 2 times the poverty level. So a booming $38,000 for a family of 3. So poverty, we know from an enormous amount of research literature, is a key determinant of child health and positive development. Poverty in early childhood, especially, is associated with lifelong hardship, including worse health, mental health, so increased anxiety, increased depression, worse behavioral and academic outcomes. So it's poverty's widespread nature. We're talking 50% of young children are living in low income, that 2 times the poverty level. So widespread nature and known lifelong risks that make it a public health crisis. So today we're going to talk about the double whammy of a pandemic on top of an existing public health crisis. So a lot of literature suggests that poverty impacts children directly through the deprivation of goods and services known to support health and positive development. And those goods and services are things like access to nutritious foods, access to healthcare. Sounds like some of the things you're going to be talking about actually in your upcoming sessions. Educational toys and games, educationally stimulating activities. These are the goods and services known to support development that cost money. And poverty directly impacts kids by depriving them of these expensive things. But really importantly, poverty also impacts children indirectly by chipping away little by little at the health and well-being of their primary caregivers. These are the anchors of their development, the engines of development, especially for young children who don't have much agency, are the people who construct and promote their environments. And those would be their parents and their teachers. So when poverty impacts parents and teachers negatively, it impacts children negatively because those caregivers shape children's developmental environments. The negative indirect effects of poverty on development include increased risk of household food insecurity and increased risk of parental depression. So food insecurity, for those who don't know, is inadequate access to the type and quantity of food needed to fuel a healthy and active lifestyle. It includes worry about food and also provision of food. It is not synonymous with hunger, although it includes hunger. So food insecurity and parental depression, which often go together themselves, are both linked with worse child health and development. So it's not hard to imagine. I mean, Snickers had a whole advertising campaign around using the word hangry. You know, when you're hungry, you're not yourself, get a Snickers, because you get hangry when you're hungry. So this is true for parents and teachers too. Caregivers who are hungry get hangry. They are impatient, they are irritable, they are worried and distracted, and they may be withdrawn. Those are symptoms of depression. That's also what kind of food insecurity brings about. So you can imagine parents and teachers who are food insecure and or experiencing symptoms of depression are going to provide less sensitive and responsive care for the children in their care. Not surprisingly, two of the most widely documented effects of COVID, which we know has increased unemployment, decreased wages and financial resources, one of the most widely documented effects of this pandemic on families with children is increased food insecurity and increased depression. So this has been documented nationally. And we've also found it in a study that I'm leading, which I'll talk about a little bit today, the Tulsa SEED study. So Tulsa SEED stands for School Experiences in Early Development, is not an experiment. It's an observational study where we've just been following low-income families since their children were 3 years old in 2016 in Tulsa, Oklahoma. So we started with a cohort of kids who were 3. They entered 4-year-old preschool when they were 4. We added a few more kids. They entered kindergarten when they were 5. We added a few more kids. We're talking about a sample of about 1,000 low-income kids in Tulsa, Oklahoma, who we've now been following for 4 years. Every year of the study, we've administered direct assessments of children's development, health, and well-being. We've observed their school classroom environments, and we've surveyed their parents and their teachers every year. So when COVID struck, schools closed in Tulsa. All of our kids were in first grade in the Tulsa public schools. So instead of continuing with in-person child assessments, which we couldn't do, we fielded 2 surveys, a pair of COVID-specific surveys. One went to the parents of the children we've been following for 4 years, and one went to those children's first grade teachers. We sent those surveys out electronically between 6 weeks between the end of May and the beginning of July in 2020. The schools closed on March 16th. And we asked parents and teachers about, among other things, their food insecurity, their mental health and depressive symptoms, and other stressors like income and job loss, and their experiences remote learning. So when schools closed in the middle of March, Tulsa Public Schools, where all of our sample children were in first grade, like schools around the country, moved their instruction online. So teachers had maybe a week to kind of scramble and put all of their instructional content online. Parents had maybe a week to figure out whether they had a device and internet connectivity to start to kind of become homeschool teachers. So what did we, oh, yes.
Yeah, just one quick clarifying question coming in. How many kids again are in the SEED study, and how many have been tracked over the total number of years?
So we started with about 1,400 and we're down to like around 1,050. So I had said 1,000 earlier. So we're following about 1,000 kids right now.
Okay, thanks. And just for the viewers out there, that question was from Kara Newhouse of the Howard Center for Investigative Journalism. But if you have questions, toss them out there and I'll work them in as best I can. So sorry to interrupt, Anna, but back to you.
No, I welcome questions. And I had said I'm a fast talker at the beginning, so I tend to get going and it's hard to stop me. So please just jump in. I welcome it, definitely. So what do we find in our Tulsa Seed study following about 1,000 families and children? Now, only about 600 responded to our COVID surveys, but of those 600 who responded, we learned a lot about what they were experiencing between May and July. So these low-income families have not surprisingly faced loss of work, loss of income, increased food insecurity since the pandemic began. So about 46% of parents in our sample have seen a decrease in their work hours or lost their jobs permanently. Nearly half experienced food insecurity, and about 60% reported a decrease in household income. They also tended to, if they reported food insecurity in particular, that middle figure, they also were more likely to report higher rates of depression. So in the psychological literature more broadly, and in our study as well, you see a high correlation between food insecurity and depression. We see that here. So parents and children's mental and behavioral health seem to be suffering during COVID. So 1 in 4 parents in our sample reported experiencing depressive symptoms, and nearly 50% of parents said that their child had experienced increased emotional or behavioral problems since schools closed and the pandemic really took hold. So those are pretty staggering figures. So 25% of parents reporting depressive symptoms and nearly 50% on behalf of their children reporting depressive symptoms. So we also surveyed the teachers, the first grade teachers of our first grade children, and the teachers reported remarkably similar stressors. So they also reported income loss, although they were employed by the public school district the whole time. Someone in their household probably lost a job and they experienced reduced income, food insecurity, and depressive symptoms. So very similar picture to the parents in our sample, which means the kids are getting, now we might want to call it a triple whammy. They've got parental stressors, teacher stressors in the context of a pandemic, in the context of poverty. So 20% of teachers experiencing food insecurity, 25% increasing a decrease in income, and 1 in 3 reporting depressive symptoms since the start of the pandemic. Same pattern with teachers and parents, that depression and food insecurity were highly correlated. Again, that's something that we might expect based on broader research literature. So I won't talk much about this, but I do have another project going on at the same time. This study is entirely different. It's in Lancaster, Pennsylvania, and it's a study of a backpack food program that's been going on for a couple of years there. And one of the things we're doing as part of that study, which is focused only on food insecurity among low-income families who take backpack food home at the end of the school week, part of that study is a text-based daily diary survey of parents. So what we've been doing in that study is texting parents same 16 questions every night for 2 weeks for 6 months. And we were doing it before COVID, and we kept doing it during COVID. So in this particular study, we're texting parents nightly questions. How do you feel today? How's your food insecurity right now? How is your depressive symptoms right now? And how are some other things going on right now in your household? So we're tracking daily responses to these things from January through COVID. And what we found in that entirely different study with a different low-income population in a different state is that, and these are pretty crude graphs pulled just from the data we analyzed, COVID hits right around here between March and April of 2020. Schools closed in Pennsylvania just like they did in Tulsa, just like they did in DC. And what you see is an increase in parents reporting that they're worried they will run out of food, which is an indicator of food insecurity. So as soon as COVID hits, you see a marked increase, and that is statistically significant, in how much parents worry about food, likewise how worried or depressed the parent felt. So this is not an isolated pattern that we see only in Tulsa, Oklahoma. We see it in Pennsylvania in a study focused on a different low-income population. Increased food insecurity, increased parental depression. And lest you be concerned that I've just alighted on the 2 populations that are experiencing this, national data bears this as well. So national data from the Brookings Institution's Hamilton Project, focused on understanding experiences of individuals in poverty and low-income status, also shows precipitous increases in food insecurity among households with children over that same time period. So these scholars estimated using national health interview survey data and monthly unemployment rates what the food insecurity rates would have been. These are their projected rates, the kind of predicted rates down here. And then what it actually was among households with children in the spring, late spring of 2020. And so the actual average rate of food insecurity using these weekly census pulse surveys, which is a subset of census respondents, is much, much higher than it would have been predicted to be otherwise. So all of this together, high rates of food insecurity in Tulsa, in Lancaster, Pennsylvania, and nationally, which we know goes along with high rates of depression, all of which is bad for children and child development. This might explain why scholars and journalists are sounding the alarm about COVID exacerbating income-based achievement gaps. This story has been on the front page of the New York Times, many, many, many days that I've checked recently. A lot of worry about what is going to happen after COVID. We're going to have these low-income kids with an even bigger gap between their skills and their higher income peers. Because parents who are worried about food access and who are depressed are more likely to struggle with the added burden of supporting remote learning. They've all of a sudden become homeschool teachers and they don't have the resources. And in fact, in our Tulsa study, we see exactly that 65% of low-income parents reported struggling during distance learning. These are their most commonly reported challenges. So a third of parents who reported struggling said it was because the child needed more support than the parent could provide. Many of these parents are still working. They're trying to work from home. They're trying to find jobs. They're trying to take care of other children or elderly or sick family members. The other big reason that low-income parents struggled with distance learning is lack of consistent internet access. 20% of low-income children in our sample never communicated with their teacher after schools closed. So their school year effectively ended in March. And we know something called the summer learning loss or summer learning slide happens, where over the summer low-income kids lose a lot of what they've learned and they have to do a little more catch up in the fall. This is like an extended summer learning loss, adding 3 or 4 months to a slide we already knew would happen. And we know this is happening because some really, really innovative scholars have taken advantage of a math app called Zearn, which is aligned with the Common Core math curriculum that many public school districts use. And many, many, many schools were using Zearn, this math app, to teach math before COVID. And so these scholars at MIT took Zearn data and looked at what high income, middle income, and low income school students were doing with Zearn pre and post COVID as a proxy for school engagement and math learning. Because Zearn is a cute little app where you earn a badge and it goes like bling, yay, every time you learn a new skill. And so kids earning badges, which is what's on the y-axis, is a kind of a proxy for doing more math at home. And you can see that low income, middle income, and high income schools are roughly tracking together with their Zearn badges earned up until March 16th. And then you see that the lowest income students fall off on Zearn use and badges earned, while the high income students reduce a little bit. I mean, sure, everyone was spending more time, hopefully, playing in their backyard and enjoying, the fresh air when school wasn't school anymore. But high income students were still earning badges and low income students were not. So what can be done about this in the short term? If you think that, as I do, the public health crisis of poverty compounded with the public health crisis of COVID has made successful learning and health and development promotion among low-income households at home even harder, we need to address those problems first. And food insecurity and depression in many ways are related to fluctuations in income. So one short-term solution might be to ease access to unemployment and other cash benefits for low-income parents. So some work done by those same folks at the Hamilton Project at Brookings suggests that almost half the increase in food insecurity during COVID is explained by unemployment. So if we can offset the income losses of unemployment, maybe we can reduce the increases in food insecurity, increase family functioning, boost children's well-being at home, help remove those burdens for parents so they can help their kids continue learning. We know that take-up of these kinds of programs is low even in the best of times among the lowest educated and immigrant parents who face obstacles to enrollment. So easing the application system for families who are already dealing with hardship and chaos would be a way to expand these benefits, making them available and then easing access to them. Increasing internet access would be huge. So I'll remind you that 16% of parents in our sample reported they struggled with distance learning because they didn't have good internet access. 20% of kids never logged on and talked to their teacher again. So mobile hotspots, let's get creative. Some cities are outfitting unused school buses with mobile hotspots and landing the school buses for the school day in the neighborhood that struggles with internet access. Let's find a way to get internet to these households so these kids can keep learning. And finally, making mental health resources available via online school platforms. So I know my own kids in DCPS, I know the kids in Tulsa Public Schools, I know the kids in Lancaster Public Schools are all using different versions of Zoom or Microsoft Teams where they log in the morning and they click different buttons for their content for the day. And it wouldn't be so hard to have a breakout room or a content button called Get Help Here. And you have access within your school day remotely to a school counselor, a school social worker, even a school nurse, where parents and children can check in and get some much needed mental health support. So I have a list of references and resources at the end if you want to follow up on any of the statistics I shared or the studies, and I have more where this came from, but I don't want to overwhelm, so I'll stop there and say thanks, and I look forward to your questions.
Okay, so for our viewers out there, the resources that she has, we'll get those on our website as well, so you have full access to those resources as well as others. We will also be providing a transcript of this full session, so you can have a good high quality transcript of what both of our researchers will be talking about today. We'll move to Hero in just a second here, but I have one very quick question about the Pennsylvania study. So you said that's just on methods. That's a daily text exchange with the study subjects. In the midst of COVID, with everything that was going on, was there a big drop off in how many people were actually responding and maintaining their daily logs?
Yeah, so for time reasons, I didn't go into too much detail, but that's a great question. So we paid them for every question they answered, for every day that they answered the questions, and they got like double bonus payment for answering all the questions. So they were incentivized to answer all the questions every night. So if you answered one question, you got something like $1. If you answered all the questions, you got $5. If you answered all the questions for the 1 week period, you got $35. All the questions for a 2 week period, you got $70. So they were actually quite responsive. And many of them, there was an option to text back like an open message, and many of them wrote back like, thanks so much. This is, I like this, and thanks for the cash. They seemed actually pretty engaged.
Okay. And your studies in Tulsa and Pennsylvania, this is a very kind of general question, but why Tulsa and why was it Central Pennsylvania? I mean, how did you alight on those two spots, and how replicable or generalizable are those two spots to what other people are seeing around the country?
Man, that's a tough question. I mean, all politics is local, and so is education. So it's hard to say that anything that happens in a school district or a zip code even would be generalizable to any other school district or zip code. The short answer to your question is why Tulsa is that my senior collaborator and mentor, Deborah Phillips, who's also a professor at Georgetown University, has a longstanding research partnership with Tulsa, because they started a really unique universal pre-K program in the late 1990s. It's a red state with a very blue, considered to be kind of more democratic, progressive initiative of expanding universal pre-K access to all 4-year-olds, and it did it pretty early with a cigarette tax levy. So it's a unique program and a unique place to do education research. That's how I started there, because I worked with Deborah. And she had a research partnership with a school district, which takes a long time to build. So I kind of, came in on her coattails and built the study from there. And it just so happens that we were asking a lot of really relevant questions about things that would have been affected by a pandemic. They're the same things that would be affected by poverty, which is why we were studying them. The Pennsylvania study is really different. I have studied food insecurity for a while, and I just happened to be giving a talk kind of like this one to a bunch of pediatricians. And one of them came up and said, I know someone who runs a backpack food program in Lancaster. It's really unique. It's like Blue Apron for low-income families. So it's not just food in a backpack, it's recipes and perishable foods at low cost. And I want to know if it works. And I could set you up and you could do an evaluation. And so I kind of made friends with the program. And the Daily Diary survey is like the 3rd year of our evaluation of a local program. So how replicable are either of those things to other contexts? They're both, the reason I'm there is because there's something unique about them in both cases. So it's hard to say. I mean, our data in Tulsa, our sample is representative of 1st graders in Tulsa public schools. It's a very low income, very race ethnic diverse school district. So our sample is relatively generalizable to the grade level in Tulsa. How much Tulsa is generalizable to other school districts, I would be reluctant to say.